All right, we're ready to jump into chapter 10. This is where it gets fun. So I'm excited about this for you guys as you start getting into the nitty gritty of scrubbing and the instruments now. So now we're not into just so much of the legalities and such. So now we're getting into the real thing. So after you study this chapter, you're going to be able to explain the relationship between instrumentation, equipment, supplies, and how that serves with the patient quality, with the quality patient care in the OR. Also being able to explain the relationship between instruments, equipment, and supplies and the OR environment with safety concepts. Indicate items that require sterilization prior to use in the sterile field. Recognize basic instruments by type, function, and name. Demonstrate proper care, handling, and assembly of instruments. And then differentiate the types of special equipment utilized in the OR. Practice and demonstrate proper care, handling techniques, and safety precautions. Also, you'll be able to cite the names and functions of accessory equipment and demonstrate proper care, handling, and assembly, and collect and prepare used supplies used in the OR. So first of all, we have thinking about what they're made of. So modern surgical instruments most are made of stainless steel, but they have a combination of alloys of carbon, chromium, iron, and a few other of the metals. Now, chromium, it does have an increased resistance to corrosion, so you will see it used more so in a lot of cases. And then titanium, it is stronger and lighter in the weight. And then what's really important is that it's non-magnetic. And so that's why you'll see in orthopedics, a lot of plates are made out of titanium, screws, things like that. So then they're still able to go in for like an MRI procedure and the titanium is non-magnetic. There's different types of finishings. And so just regular stainless steel, that's going to have a really high polish finish. And one downside to that is that it has a high reflective point. And so when surgeons are working in a cavity and then there's multiple bright lights on the surgical site, and with high polished stainless steel, then we're risking that reflective interference. Now satin, so that's more like a brushed finish, and so it has more of a dull type of reflective, where ebonized, that it has no reflective capacity. So those are more, the satin and the ebonized are more desired when we're concerned about reflections. What are the different classifications of the instrument? So we have cutting and dissecting, grasping, holding, clamping or occluding, retracting, viewing, probing, dilating, suturing, and suctioning. We're going to cover each one of these in detail. So we'll start with cutting and dissecting. So of course, these are instruments that have sharp edges, and they can have one sharp edge or more. These are going to be used when making incisions, also when there's sharp dissection, compared to blunt dissection, which will usually use scissors and use perform blunt dissection. But for sharp dissection, we'll need a cutting or dissecting device. Also excision of tissues. And so this includes scalpels and knives. What the difference between a scalpel and a knife is, scalpels typically have a non-disposable handle and a disposable blade. And so that is what you've been practicing with in the lab, to load a scalpel blade onto a handle, whereas a knife is the entire handle and blade is non-disposable. So the entire thing is going to be sterilized in that process and reused. Scissors, of course, we'll go over those different types of scissors. There's bone cutting instruments, so that's including saws, drills, the biopsy punches, adenotomes and dermatomes. And so tome means cutting device. Then the word before tome is telling you what material, what tissue that cutting instrument is used for. Osteotome is another example of a type of a cutting device. And you can see here, these are bone cutting. These are osteotomes, the picture. Talking about scalpel blades, handles and blades. This whole thing is bolded because this is extremely important that you understand this. However, you have to learn this very well. Know that the blade sizes and the handle sizes and what blade goes with what handle. Also understanding what blade is used for what type of a procedure. So blades 10, 11, 12, and 15, they fit 3, 7, and 9 handles. Blade 20 through 25 fits a number 4. Now you'll see some blades that are labeled a 3 or a 3L or a 4 or a 4L. What the L stands for is the length. So a 3L and a 4L, they're longer, so then they're utilized in deeper wounds. Now, a number 11 blade, that is usually what we see when we're in a case where they're incising a blood vessel, or if they're creating a what's called a stab wound to place a drain in. So a number 11 is what you're going to usually see for that. A number 12 blade is typically used more for like tonsillectomies and things like that. So just reading through the chapter as well, because there's a lot of description about what blades are used for what procedures, but these are some that I want you to be sure you are fully aware of. But read through that chapter, make flashcards if you need to, whatever you need to help you fully understand blades and handles and how they're used and how they work together. Now, scissors, we have many different types of scissors, and they're used for different things. So, and you can see there's pictures of some of them down here in the corner. And then I'm going to ask the instructors to really work with you guys on these instruments more this week of what is used for what, as far as all of the material in this chapter. But a curved mayo, you'll see that used more when there's a heavier tissue. So it's about what is the depth of the tissue, because if it's medium to fine depth tissue, then that could be something like curved Metzenbaum can handle. But if it's a heavier tissue, or thinking about certain areas of skin is going to be heavier as well, and so sometimes that may require a scissor for that incision. Jameson, Westcott, Stevens tenotomy, Pot Smith, these scissors are always used for really delicate tissue. And then the straight mayo is rarely used for tissue, but it's used more for cutting sutures. And then when you're looking at sutures needing cut in like a plastic surgery or ophthalmic, then we're going to use a straight iris. And then in cardiovascular surgery, we'll see most of the time the curved Metzenbaum is used for that type of procedure. So just make sure that you're familiar with all the scissors, when they're used, what they're used for, and how to recognize them. And then the class of grasping and holding. So now we're looking at forceps type material or type instruments, because they're going to hold tissue and they're able to manipulate tissue. So they really help with facilitating the dissection of tissue, as well as suturing or reducing. So bringing incision together is reducing. They also help to reduce and stabilize fractured bones. And so reduction is just it's a medical term for bringing tissue together, whether it's skin tissue, bone tissue, whatever that may be. And so this is one way that these devices are used. They may or may not have ratcheted locking mechanisms. So some of them do and some of them don't. And so it just depends on the device. They can include tissue forceps and bone holding clamps. And so we'll look at a little bit more of that. So with forceps, we have some that have tooth and some that are without. And I'm going to jump over to the book. We've already covered scissors. those are your blade handles. So here's your scissors just to recover. Metzenbaum. This is a curved Mayo, and that's a Pot Smith. Make sure you go over this chapter really well. Here's the tissue forceps, and you can see the end of them. Here's one with teeth, and we also will have some without teeth. And so those are dependent on what type of tissue they're being used for, because you can think about tissue that is very delicate, say vessels. We don't want to use teeth, forceps with teeth in those, because they could tear and shred that tissue. Some examples of forceps: Addison, Fair-Smith, DeBakey, Brown, Russian, Gerald. Those have they come with and without teeth. Cushing bayonet, which also come with and without teeth. Now the ratcheted forceps, these are the Alice, Badcock, and Kosher, and then there's also those bone holding clamps. So let's see. Here's some more of those. Here's your Alice. There's your Badcock, and there's your Kosher. So these are some of your ratcheted grasping holding instruments. Here is a bone clamp. This is the Lane bone holding forceps. So you can see with the more pronounced teeth than some of the other forceps, it's going to be able to grasp the bone really firm and not allow for movement. So now we're going to talk about clamping and occluding instruments. So they're going to either constrict some tissue or they're going to occlude it. And so we see these used in especially like vascular cases, intestinal, or if they're needed, used for hemostatic purposes to stop blood flow. Now they have opposing ring handles and interlocking ratchets. This is a big thing. And then they have two shanks that connect those ring handles to what's called the box lock. That's important that you know that, because the box lock is also where a lot of times you are holding the instrument as you pass it. And it's also the hinge point of the clamp. Let's go back and look at some of those. So here we have, this is the box lock area. This is typically where you would hold that to pass it to the doctor. You can see there's the tips, the jaws, the shanks, the ring finger or finger ring, and then those ratchets there. Here's some more. Here you've got the mosquito, the krill, and the Kelly. These are really common. You're going to be using these every single day. So you've definitely got to get familiar with recognizing them by sight and understanding what their purpose is and when they're going to be used and asked for, because this is important that you understand the instruments and when they're used and why they're used, because this is going to help your skill of anticipation, which makes you an excellent scrub. Now, retracting and viewing instruments. So of course, as we're in a surgical site, we need some of that excess tissue out of the way so that we can clearly access the site. Retractors, there's a lot of improvements that have been made to retractors in the last few years. And I've got some pictures of those, but these are designed just to expose the operative site. And then there's also viewing instruments that may provide retraction, but the main purpose of them is to really allow for that visualization of structures. So here in the book, you can see here we've got Army, Navy retractor. Here is a retractor system. This is a Balfour, but then we also have these systems that can be put into the site and ratcheted out, and then allows for hands-free. This ribbon, this is called a malleable retractor, and malleable means that you're able to bend it and conform it to the tissue as it's needed. And then we have a Gelpy and a Wetlander, and so these are some of the non-ratcheted devices. So they have a release button that you can play with those in the lab, and feel free to ask your lab instructors when and how these are used in their experience for all of these, if they've not already covered that with you. Here's some more retracting and viewing instruments. This is a Deaver and Richardson's. And so you can see this, the Richardson has two sizes in one instrument. So it has one depth on one end and then a longer depth on the opposite end. So it makes them kind of a multi-purpose tool when we're looking at retractors and how they're used. Again, here's some, here's a retraction system. Here's the Army Navy. Here is the wet lantern, but this retraction system was probably the most amazing thing for scrubs that they came out with, because once this is put in place, no one has to hold. Before, there were extra people in the OR because they had to hold retractors. And then probes and dilating tools. So these are used to explore a structure. So whether that be an intestinal structure, a gallbladder duct, a blood vessel, a cervix, you know, probes are used to explore fistulas, as well as the other mentioned ducts and vessels. Now, dilators, this is used to gradually dilate an orifice or a duct, and that allows you to then introduce a larger instrument, or it can open a stricture. So this could be used in places where there's like an esophageal stricture or blood vessel strictures. You know, different areas can have a creation of a stricture, and that causes a narrowing of that diameter. And so a dilator is used to gradually increase that diameter. This does include the urethral dilators, and you will see this used a lot in GU cases where there is a stricture in the urethra. And so dilators are used to gradually reopen that diameter back up. Here's some. On the left are probes, on the right are dilators. So you can see how you would start with the one the farthest bottom and gradually remove it, insert the next one as the tissue is dilated outward. And let me check the book, make sure there's nothing in the book that I wanted to include. No. Okay, now we're going to talk about sutures. Here's another area. This is super important that you fully understand all the different types of sutures, and there are a lot. I get that. There's a lot. Just start exploring those in the lab, you know, pulling some out, asking the instructors when and how that specific suture is being used, and what type of case you would want to have extra sutures and things of that nature. So, of course, we have needle holders, and this is used to hold the suture. You guys have already been practicing with these, and you should be proficient at loading a suture now. And so let's look at some of that. So here is your needle holder, and there's different tips. And so you can see there's different sizes. They do have teeth to hold that needle in place. And now talking about suction. So of course, suction is to remove any body fluid or blood from that operative site, and because that can interfere with visualization. And so there's different types of suction. This is a Fraser suction tip. Here is a Pool on the right and a Yonker on the left. And these are reusable. So these are stainless steel. You will see some disposable ones as well. I'm not sure if those are used in the OR setting, but I know in a hospital setting they are. So again, needle holder, Fraser, Pool, Yonker. Micro instrumentation. So these are devices that are used when we're performing microsurgery. So very small, delicate pieces. So you'll see these used when in neuro. You'll see them also used in plastics a lot. You'll also see them used in ophthalmic or ENT. So all areas of ear, nose, and throat are going to be looking at microsurgery instruments. These are typically made of titanium or stainless steel, and many times they're used with a microscope. And so that allows for both manipulation and repair of very small structures or tissue. And they're held with the thumb and the forefinger. So they're not held like all the other instruments. And as you can see here, they have kind of an opposite effect of scissors. So as you can see on the far left, it does look like these are a scissor. They look like a curved scissor. I can't really tell what they are. But as this is compressed together, then it is bringing the blades together. And so here you can see there's forceps, different types of forceps. So there's a lot of different types of microsurgery instruments that are, and we have several in the lab, I remember. So instrument care and handling. So these are the different cycles of and different phases of how instruments are handled during a case. So we have preoperative tasks. So in this, you're looking at the preference card and gathering all of your instruments, whether it is an instrument set with additional instruments added to that, because the instrument set may not include everything that the surgeon needs for that particular case. Also, we may see that you're having additional for anticipation of a complication. And so that is an important thing to always consider. Of intraoperative tasks, then we're looking at anticipating the next step in the case and the handling of the instruments to the physician, and ensuring the proper care and function of the instrument. So an example of that would be if you're in the middle of a case and there is an instrument that malfunctions, that ratchets won't close, and those you're going, those are tested in central sterile, as we saw a couple weeks ago. But in the event that you find something that is dysfunctioning in the OR, then you would remove it from the sterile field and replace it. And if needed, then you would be able to, then you would need the circulator to obtain some more from central sterile. Post-op, then you're going to disassemble some of the instruments. You're definitely going to start the cleaning process, sorting them and getting them prepared and to return to central sterile. And you're basically taking the first step in that process. Now, surgical instruments have to be handled with great care during all of these phases, because it's important to not only just extend the life of the instrument by providing that care, but you're also preventing injury to any of the staff. So the surgeon, the assistant, the patient even, and yourself. And it also allows for correct performance and consistent performance, so that with every case, you're getting better at caring for the instruments and how that they're used and how that you're handling them. That will just come over time. So there's different types of instrument sets. If you guys know, in our lab, we're a little limited on the instrument sets just because they're extremely expensive for a full set. And so that is another reason that you want to make sure that you're cost conscious as you're handling these sets in the OR, that you're conscious of the cost that is involved with obtaining them, and that replacing instruments is going to be a cost for the facility that they will have to cover. So you want to be conscious of that and keeping the cost low. So instruments within each type of set are standardized according to the procedure and the facility's needs, but primarily to the procedure. And the facility needs also includes the surgeon's needs. So different surgeons are going to want different instruments in a particular case set. And so that's when instrument sets are created according to a standardized list, but the facility / surgeon may require additional ones to be added to those specific sets. And you will see facilities that have specialist that have their own instrument sets. So that just helps you see that, like, if there's a ortho, or an orthopedic surgeon, and they're doing a lot of cases, they may have very specific instruments they want in their set. So it's more beneficial to Central Sterile to just create an instrument set specific to that doctor, and then it's labeled accordingly. Let's look at the book, see if we've got all of it covered. So read through this, of course, on the handling, make sure that you understand what these steps are in place for. Here's the different instrument sets types. So this is a minor set, and you can see that each instrument named has a quantity associated with it of how many is in that set. And this also serves as your count sheet. So you'll, when the set is assembled, then that is indicated, but then with the initial count, then the first count, and then the final count, all of this is indicated on here, just to ensure that all of the instruments are returned to the set and nothing is left in the patient or even around the patient or in the OR. And so that's a sample instrument list. And then there's different procedures that are going to require like a smaller secondary set of specialized instruments. So an example of this, I know we talked in the past about if you're working in L&D and you're doing a vaginal delivery, you always have to be prepared for a C-section delivery to be the case. And so that's one case. Also, if you're doing, I think the book refers to, in this one, a cholecystectomy, and how that sometimes you'll need to have additional instruments for that. We'll find it. So, but just know that there are situations where you'll want to anticipate any complication and have that additional set on standby, so that if it's needed, you don't have to take the time to call down for it and get it delivered, that you've already anticipated the need. And then if it's not needed, it can be returned. So a laparotomy set, laparotomy just means an open procedure. And so this is used when we're looking at general abdominal procedures where the patient is being open. It does usually require a major and a minor set, both. And we'll see these if we're looking at peripheral vascular disease, bowel resections, cardiothoracic, craniotomy, and orthopedic. You can see here, here's the count sheet on this, and there is a lot of instruments that's in a laparotomy set. So laparotomy sets are one of the major sets that there is, just because you're looking at a lot of the, you're having to have everything in there, basically, not only just scalpels, retractors, forceps, needle hole, you've got to have everything in there. So those are your basic lap sets. And then the instrument list count sheet, we looked at that already. Count sometime may be waived if we're looking at an emergency case, especially the initial count. And so this is because you're needing to get set up and in as fast as possible, then you will do a final count, and then you can make sure that it matches the set numbers that were supposed to be in it originally. And of course, this is what your circulator is going to assist you with, and make sure that you have the support of creating that count and making sure that everything is as it's supposed to be. So now endoscope. So I'm not really going to use the PowerPoint for this. So the endoscopes, these are when we're needing to access the body within a cavity of a hollow organ so that we can just, we don't have to provide that laparotomy opening, so that we can just either look through a body opening already, like the urethra, or we can make those small incisions and use trocars and then insert the endoscope into that cavity. So of course, then you've got the eyepiece. Here is a lumen that allows for addition or aspiration, so you can inject and aspirate through that. And then of course, this is the visual tube. And that is a flexible one. Of course, they're fiber optic. So they have cameras on them most of the time, but they can have some without them, but most of the time they do. But there are things like bronchoscopes that there's not necessarily a camera. They're just looking down the eyepiece as they progress the tubing. So here you can see cholecystoscopes. These are for the biliary system. Mediastinoscopes. These are looking in structures in the mediastinum. Ureteroscopes, looking in the ureters. Angioscopes, looking in blood vessels, heart and major vessels, or vascular endoscopes for the smaller vessels. Ventriculoscopes, looking at the brain's ventricular system. And fetoscopes for visualizing the fetus in utero. A lot of instruments now to have monopolar cautery on them, or bipolar electrosurgery. So that is used during laparoscopy as well. Okay, and then we're using powered instruments. So there's a lot of powered instruments used in especially orthopedics. And so, of course, here we have an oscillating power saw, and these are usually pneumatic, so they're using air. And so this is going to be used, and you will see this in orthopedic videos that we watch in the future, or if you've already been in that term, then you've already seen where this power saw is used to cut through a bone that we're looking to replace. So meaning, we're doing a knee replacement, we're using this bone definitely to cut through that bone. Also, we will have drills. So it's not just saws that we're using. We will use drills to maybe secure a plate on a fractured bone. We also use drills in the skull. And sometimes this can be done just to relieve pressure, or it can also be used to create what's called a bone flap, and that allows access for the brain. We also will use a power tool that will drive pins in, and that helps to reduce the fracturing of the bone because hammering it sometimes can lead to that fracturing. Sanding. This is done when an area has some rough edges that need sanded down. So there are some power sanders that are used, and then also used on the skin for dermabrasion. Another way that power tools are used are in patients that need skin grafts. So we will watch that when we're in that chapter on integumentary, where we're seeing that skin graft machine cut that thin layer of skin off the patient that will then be used for a graft. And then microscopes. So we've got a couple of videos for you guys, because I know that y'all had some concerns with the videos that we had been watching about draping, and that draping of a microscope was not covered. So I've got a couple of videos for you guys to watch on how those microscopes are going to be draped by you. But know that there's different types of microscopes. There are some that are ceiling mounted microscopes, and then some that are rolling floor microscopes. So I'm going to let you read through that part of the chapter really well, and make sure that you're comfortable with the magnification, you know, how that is plays a part in the ability for the surgeon to view the micro area, you know, because if we're looking at microsurgery that needs a microscope, then we're talking usually about neurosurgery or vascular surgery or plastics or ENT, and ophthalmic as well. So this, of course, is a floor type of microscope. And then let me get that video pulled up for you. Let's stop the share, make sure that I checked the, no, I did not, okay.
Before draping the microscope, make sure the binocular tubes are configured in the correct position. And check that the balancing has been done properly. The non-sterile nurse should open the drape for the scrub nurse. Grab the drape with the hand picture facing you. Unfold the drape, first to the left and then to the right. The instructions must be upright and facing you. You will find several rubber bands. Detach them and keep them with you, as they will later be useful to help secure the drape. Find the hand sticker and slide your hand inside the drape to find the lens cover. Hold the tab containing the white dot with your thumb, and the other tab with your index finger. Lift the lens cover at the same time as the remaining drape. Match the white dot on the lens cover with the black dot on the microscope, and twist to the right until you feel it is secure and locked into place. Move the drape over the microscope head and pull it over the rest of the arm. Your circulator can assist you, pulling the drape from inside over the microscope arm and wrapping the last band. It's now time to drape the eyepieces. The drape has several eyepiece covers. Choose the middle one from the three facing you to drape the surgeon's eyepiece. Then use the other ones depending on the number of eyepieces to be draped. Be careful, the eyepiece drapes are perforated at their end. It is important to be gentle in order to avoid any detachment. Secure the drape using the Velcro straps. Put the remaining drape inside the empty space. Make sure the drape is not covering the lens. Wrap the bands around the microscope head and arm, placing them taped to tape and not taped to plastic, and making sure the drape is fitted airtight to the microscope. Check that the straps are attached around the microscope head and around the arm as shown in the images. Choose the option that best suits your surgical practice. If necessary, the rubber bands can be used to keep the drape tighter to the handles and the main surgeon and assistant binocular tubes. If your microscope is equipped with SMARS, the circulating nurse will press the SMARS button. This will activate the pump to extract the air from under the drape. Rotate the microscope to ensure that it can be moved easily in all directions. The drape shouldn't interfere with microscope movement. You are now ready to work with the Leica microscope.
To drape the microscope manually, make sure that the drape button on the touchscreen is inactive. After unfolding the drape, insert your hands into the special positions indicated by the stickers on the drape. The OPMI drape has a special lens fitting for the objective. Place the fitting over the objective, and then move the drape over the head of the microscope and hand grips. Make sure that there is slack in the drape to allow for swivel, tilt, and rotation of the microscope, especially around the hand grips. Pull the drape over the rest of the arm. Using one of the straps, make the drape airtight at the farthest position. If the microscope is equipped with auto drape, press the drape button in the main menu. This activates the pump. The pump system increases to maximum power for 2 minutes to extract the air from under the drape, and then switches to a lower speed to maintain air levels. Once the drape has been secured, check to ensure for ease of movement of all controls.
Okay. That's a couple of views of different ways to, and it's basically the same, just allowed you to see two different views of it. So the magnification of the microscope, of course, this is what's called the resolving power. So this is allowing the surgeon to use different powers of magnification to look at tissue from different, in different magnifications. So they may look at it at 10x, which is looking at it 10 times what it normally is, or 100x or 400x. So all of this is allowing them to see more detail. You'll also see additional equipment in the OR like illuminators or video monitors, recorders, cameras, the fiber optic headlamps and different light sources. Of course, you're going to have the OR lamps above that you'll put the cover on the handle. Then a pulse lavage irrigator. So this may be used when they're irrigating a wound and they just need a pulse of irrigation fluid pulsed into the wound and not a full steady stream of irrigation. Then there's a phacoemulsifier. So this is used primarily, I've seen it in ophthalmic cases where it uses an emulsifier to erode the tissue rather than having to use a high pressure irrigation. And then it also has irrigation aspiration units on it. And that allows the surgeon to use the phacoemulsifier to erode, say, the iris, and then irrigation can be applied as well as aspiration. So it's all in one unit. Cryotherapy units, and there's information about each one of these, of course, in your chapter. Of course, cryotherapy are used for freezing techniques. So if tissue needs to be frozen, a cryotherapy unit will be in the OR. If they're using cryotherapy for lab specimens, so they're taking a biopsy of something or they're taking a tissue sample to be sent to the pathologist, they may use cryotherapy to prep that for the pathologist. Insufflators, of course, are going to be used to inject air into a cavity to provide better visualization, and you'll have insufflation needles in the lab that the techs can show you how those are used. Nerve stimulators are going to be used, especially during neurosurgery when they're trying to do a repair procedure, but then they also want to make sure that maybe adjacent nerves or the nerve that they're working on is still functioning, so they can use a nerve stimulator to stimulate that nerve, and then you'll see that nerve functioning and know that it is still intact. There's also some accessory equipment that is in the OR. So not only do you just have suction catheters, you'll also have the whole system components. So a vacuum source, so these may be portable. So it may be on the floor on a small rolling cart that is portable, or it may be a permanent source, which is then attached to the wall. So then you have a pneumatic attachment on the wall that allows for suction to be directly pulled from the wall. Then you have the vacuum source tubing. Let me see here. I think I have. So you can see each one of these has a different section on the in the book for you to read through. Let's look at suction systems. thinking, oh, I'm sorry, I thought they had a picture of it. Nope, maybe I was good. So vacuum source tubing, we have a ton of that in the lab. So that's the tubing that goes from your Yonker or your Pool or your Fraser to that vacuum source. Then there's a collection unit. So there will be a canister that will collect all of the suction material. And then the tubing again to the suction tip. And then all of that works together with to remove any blood or body fluid. And then of course the lights, this is necessary for the procedure. There will be overhead lighting, of course, as we have in the OR in the lab with the handle cover. And there may be additional lighting, especially if they'll also have fluorescent overhead lighting in addition to the ceiling mounted operating lights. So those are primarily the different lightings that you'll see. Pneumatic tourniquets. So there are tourniquets used when they're wanting to really reduce the amount of blood loss, or if they're needing that blood loss minimized for surgical site. So we do see this, especially like in upper extremity cases where they may use a tourniquet on the upper arm to do a procedure on the lower arm. And so these are normally these electrically operated pneumatic tourniquet components. So there's not a manual component to this. So here is an image of this. So this is the pneumatic device. This is the cuff placed on the patient. Then the pressure will be ordered by the physician of what pressure he wants on. It will typically be on lower extremities. I think it's around 100. I think maybe it's in here. Yeah, here it is. Lower extremity is 100 to 150 millimeters of mercury higher than their systolic blood pressure. And on an upper extremity, about 30 to 70 millimeters higher than their systolic pressure. You can read through this and understand the tourniquet application so that you're proficient at that. Of course, you want to check all the equipment using a stockinette. And so that's going to be that, cotton material that's placed over the extremity, and it protects the skin, as you know, in this procedure. So the time is going to be noted with this, of course, so that the adequate time of the tourniquet is used and not more. And then we have sequential compression devices. So these are SCDs. These are used with compression stockings most of the time to provide that compression of lower extremities. These are electrically operated compressors that are attached to sleeves that are then enclosed around the patient's limbs. This allows that ebb and flow of compression to kind of mimic venous movement. So it prevents the venous stasis, and it also helps to treat edema, because with that venous movement, it's going to remove that excess fluid. Now let's talk about drapes. So of course we know that there's all different types of drapes. We've got them in the lab. We've seen there's different sizes, different types of drapes, meaning you may have a drape that is a fully enclosed drape, or you may have some that are fenestrated, which means it has an opening in it. So a typical laparotomy is going to have a large abdominal area opening in that drape. So most of these drapes you'll see are labeled for the specific procedure that they were created for. So it's really about looking at the drape and then also knowing how to apply them. Drape material, it's always a non-woven fabric, or I'm sorry, it can be non-woven, but then it can also be a woven textile fabric, but mostly what we have are the non-woven. Then you do have the plastic adhesive drapes, and you guys are familiar with those, where you can use those around the incision site instead of the towels. So, and we've already talked about the fenestrated, non-fenestrated, and the stockinets. Now the sterile packs. So of course, these are the initial instruments, or not instruments, but the initial supplies that you're going to need on your back table. So they are highly specialized. They are labeled accordingly. A basic pack that will be the beginning set for most general cases. You have in there a Mayo stand, 2 gowns, a suture bag, which a lot of the covers now have a suture bag on it. They're not including those as much anymore. Then the paper drapes for the square draping, and 2 paper towels for hand drying. Of course, there's going to be more than that in it, but that is the bare bones of what would be in a basic pack. And then there's things additional that are added on top of that. Of course, in with supplies, we're looking at sponges, dressings. Of course, sponges are going to be used when we're absorbing blood or tissue fluid. It also helps with blunt dissection of tissues, where the sponge can be used in certain tissues to dissect away the tissue. And so you'll see that used where they'll just put a sponge around their finger and use that for the blunt dissection. It is also used as protection when there's important structures that need protected, say blood vessels or nerves. And then also we'll see them primarily used though for absorption of fluids. Surgical dressings, these are applied to most wounds, and there are several functions, and there's description of each one of these in the book. You want to make sure you read through all that. Biological dressings, so this is things that are synthetic skin. What is it they call them now? Liquid skin. I've seen a lot of that. Skin grafts can also be used. There's different types of dressings. There's a 1-layer dressing, which we think we can correlate that with a Band-Aid. Then 3-layer dressing. So then you've got, this is when you are suspecting drainage and you want to prepare for that. Pressure dressings are to apply more pressure to a wound, and that we've got Coban in the lab for you to understand that. Bulky dressings, again, if we've got drainage, if we're expecting copious amounts of fluid to be drained from that. Rigid dressings can be used in certain situations. Specialty dressings, packing material. The image you see on the top is a packing wound. And so that is where medicated gauze is packed into a wound, and then the wound is left to heal by second intention. So it's going to heal basically from the inside out. And on a lot of the wounds that are left open for second intention, negative pressure wound therapy will be applied. And so it's almost like a tegaderm will be placed over the wound, and then a machine hose attached to it and negative pressure. So it's basically sucking the air out of the wound, and it will pull the tissue together. So it does help facilitate faster healing. And then there's different catheters, tubes, and drains that are going to be in and around the operating site. So catheters, of course, are used to remove fluid or other objects, and urinary catheters are what's used to drain urine, but it also can have other applications, especially in GU cases. You'll see these used for other purposes. IV catheters, so this is used to infuse fluids. It can be used to obtain a diagnosis or monitor body fluids and remove thrombi as well. And then there's different types of specialty catheters, and we'll look at that. So here on the bottom left, lower left, this is a urinary catheter. So this is what's called a Foley catheter. This end with the balloon sits in the bladder, and this outer end is where we're able to have access to that. On the bottom right, this is an IV catheter. This is pre-insertion, how it looks before it goes in. There's the bevel, it's inserted in, you get a flash of blood at this hub, and the needle is thread in. I'm sorry, the plastic catheter portion is thread in, and the needle is removed, and then the IV tubing is attached to it. Post insertion, you can see the needle is retracted with a covering over it. Upper left hand, we have what's called a Swan-Ganz catheter. This is also a pulmonary, known as a pulmonary artery catheter. So this catheter is inserted into the pulmonary artery, and there's multiple ports on this device. And you can see that this area is this hub here, and it has a, it's basically called a triple lumen, and it's multi-purpose. This is a, what is this called? I cannot remember it, of course, now that I'm trying to. Tinkoff, there it is. Tinkoff catheter is used for dialysis, and this has to be placed in the OR. So they will be in the OR for the placement of a Tinkoff dialysis catheter. Tubes, there's a lot of different types of tubes that are going to be used. So GI tubes, these are going to be used to aspirate fluid. It can, here it is on the upper right. It can also be used to inject medications if needed. Here is an airway tube. So this is called an endotracheal tube. This blue tip is attached to the ventilator circuit, and it inserts through the mouth. It can insert through the nose if needed, but it works better through the mouth, and it passes through the vocal cords and into the lungs. And you can see here, once it passes the vocal cords, there's a balloon to hold it in place. The GI has the same thing, where it has a balloon to hold it in the stomach. And then we have a chest tube. This is used to drain any excess fluid and as well as air from the patient. And you can see it's inserted into this cavity of the lungs to try to help reinflate the lung tissue. All right, then we have drains, and these are used to evacuate air or fluid from a surgical and or traumatic wound. So we have passive drains. This just allows for fluid or air to move from that area of high pressure to low pressure, just like we learned about medications. They go through passive transport. This passive drain allows fluid or air to go from high pressure to low pressure. And then active drains, with those we have to use some negative pressure. So we may have to use this bulb and use a little bit of negative pressure to get it to pull some of that air or fluid out. Irrigation or syringes. So of course we've got to irrigate wounds and incisions and then aspirate the fluids. We can also use this syringes to inject medication. Most of the time, those are made of, all of those are made of plastic or glass. There's many different sizes that they come in. Of course, some examples: insulin syringes, tuberculin syringes, 3-ring or control syringes. And we've got some of those in the lab, and then irrigation syringes as well. So in this chapter, you should have learned about instrumentation and the relationship between the instruments and the equipment supplies, and how it serves the quality patient care in the OR. The basic instruments by type and function, proper care, handling, and assembly of the instruments, and the special equipment utilized in the OR, as well as the supplies. Okay, so I did not let me stop my share. There you are. I did not insert any keynotes. So what I want you to do is I want you to tell me 3 things that you learned from this chapter and this video that really stood out to you, of like, wow, I did not realize that. It was something brand new and I had no clue. So I want you to tell me at 3 different intervals, what was some of the most important thing that you learned from this, from watching this lecture and from reading the chapter even. So give me 3 things that you learned from that. I will get this loaded right now for you, and have a great day and a great weekend.